What is the first thing that comes to mind when I say ceramic? Ceramic tiles, plates, pots, pans, ceramic sculptures, everything but hip replacement. So how on earth can we make a hip replacement out of a ceramic material which is notoriously known for cracking? Well, with the introduction of newer, tougher ceramics, I would have a ceramic hip any day over the conventional plastic or metal hip replacement. And let me tell you why. An inevitable phenomenon of any hip replacement is wear of the articulating surfaces between the head and the cup, which continually rub against each other whenever the patient moves. And depending on the material used, as many as 500,000 wear particles can be released per step. These wear particles accumulate at the implant bone interface and can cause breakdown of the surrounding bone tissue, which can cause failure of the hip implant. Now, problems such as wear give a limited lifetime to hip replacements, 80% of which last between 10 to 20 years. And this is not ideal for today's patients, as younger and more active patients are increasingly having hip replacements due to early onset osteoarthritis, but also because people are living longer and want to remain active at the age of 75. And this led to the development of ceramic hip replacements that have wear rates 20 to 50 times lower than the conventional plastic hip. However, the low wear rates of these ceramic hip replacements have in the past presented a major challenge in researching these ceramic wear particles. As imagine, it's like finding a needle in a haystack. But with the advancement of new techniques, my project is now able to isolate and test these ceramic wear particles in order to better predict the clinical performance of these materials in patients. And preliminary results have shown that these ceramic wear particles are less inflammatory in comparison to the particle generated from metal and plastic hip replacements. So why is my project important? Well, my project will give further confidence to clinicians and patients for the use of ceramics in orthopedic applications, in particular hip replacements. So ladies and gentlemen, with an aging population wishing to remain active, it is likely that some of us here today may one day need a hip replacement. But the question is, which material would you choose? Thank you for listening.